Erectile dysfunction is the inability to attain or maintain an erection. It doesn't necessarily mean that you're not able to get an erection at all or that you're not able to last long enough at all. But if there's any decline in your erectile function or difficulty in getting and keeping an erection, that's considered erectile dysfunction. Despite what many patients believe, erectile dysfunction is very common. By the time patients turn 50 years old, approximately 50% of patients will have some form of ED. There are numerous things that can cause ED. When we look at medical problems, things such as high blood pressure, high cholesterol, diabetes, spinal cord injury, all of those things contribute to erectile dysfunction, as well as other surgeries that patients may have had, whether it's a prostatectomy for prostate cancer or other pelvic surgery for different reasons. All of these things can affect your ability to get and keep an erection. There are several different ways that we can diagnose ED. One of the most common one is a questionnaire that I will have patients fill out whenever they come into the office. It helps me ascertain how difficult it is for them to get an erection and get an idea about the quality of erections that they're having. Another way is a diagnostic tool using a penile ultrasound. That helps us look at the blood flow to the penis when you're not erect, as well as when you are erect, and determine if there's any difficulties with blood flowing into the penis or blood leaking out before it needs to. The things that you can do to prevent ED are the things that you can do to keep your heart healthy. That means a heart-healthy diet is great for your erections. Not smoking, making sure you're not taking in too much salt or too much sugar so that you can prevent hypertension or diabetes are all things that will help to maintain your erections. The key reason why you should see a specialist for ED is because you want to be treated correctly the first time. The longer that erectile dysfunction goes on, the worse that it can get, and our studies have shown that you lose length as ED continues. So if it takes 3, 4, 5 years for you to see the correct person to treat your ED, that's 3, 4, 5 years that you may have lost some length associated with it. There are several different treatment options for erectile dysfunction, and I always tell patients, regardless of the cause of your ED, the treatment options are all the same. There's a vacuum erection device that you can use, which is a vacuum pump that goes over the penis and draws in blood into the penis. You then use a constriction band at the base to trap that blood flow there. There's also medications that you can take by mouth that help to enhance the likelihood of you being able to get and maintain an erection. In addition, there's medications that you can inject into the side of the penis, as well as surgery with a penile implant. The patient is the biggest factor in determining what's the right treatment option for them. My goal is to let you know the different treatment options available and for you to decide which option you like to proceed. I will always tell you which ones I think are best for you, but at the end of the day, we come to a shared decision-making process with you leading your treatment options. The satisfaction rates for the treatment options for ED vary depending upon the type of treatment option you're taking. So for pills, initially, if they're working well for patients, they tend to be very happy with it, ranging anywhere between 50 and 90%. But we know over time, pills stop working and different treatment options are no longer applicable to a patient. The treatment option that has the highest satisfaction rate for both the patient and their loved one is the penile implant. And that's because it allows patients to have a reliable, consistent erection on demand. The long-term consequence to not having regular erections is losing erectile length. If you think about an erection similar to a muscle, any other muscle in your body, if you're not exercising it regularly, that muscle shrinks, it atrophies. The same thing happens with erections. If you're not having regular erections, the penile length will shrink and lose length. And there's nothing that we can do surgically to regain that length. So having regular erections is important to preserving length.